A CA's technician begins packaging instruments immediately after cleaning without inspecting them. What is the most critical risk? A. Delay in sterilization cycle. B. Increased workload in assembly area. C. Defective or unclean instruments reaching the user. D. Incorrect labeling of packages. Answer: C. Defective or unclean instruments reaching the user. The assembly area door is opened frequently, and air flows into the room from adjacent areas. What does this most likely indicate? A. Proper airflow control. B. Negative pressure in the assembly area. C. Positive airflow functioning correctly. D. Sterile storage contamination. Answer: B. Negative pressure in the assembly area. A technician notices dust and lint accumulating on packaged instruments. What is the most serious concern? A. Reduced visibility during inspection. B. Damage to packaging materials. C. Introduction of microorganisms into sterile field. D. Increased cleaning time. Answer: C. Introduction of microorganisms into sterile field. A technician assembles a surgical tray with correct instruments but places them in a disorganized manner. What principle is most violated? A. Functional. B. Accurate. C. Neat. D. Sterile. Answer: C. Neat. A technician assembles a tray with missing instruments but ensures all items are clean and properly arranged. Which principle is most violated? A. Functional. B. Accurate. C. Neat. D. Sterility. Answer: B. Accurate. A technician assembles instruments that appear clean but are still wet before packaging. What is the primary risk? A. Increased packaging time. B. Damage to instruments. C. Interference with sterilization process. D. Incorrect tray configuration. Answer: C. Interference with sterilization process. A technician brings a personal mobile phone into the prep and pack area and uses it during work. What is the most likely concern? A. Reduced productivity. B. Violation of workflow efficiency. C. Introduction of contaminants into the clean area. D. Increased communication delays. Answer: C. Introduction of contaminants into the clean area. During pack assembly, a technician finds dried soil on one instrument in a tray that otherwise appears clean. What should be done next? A. Send the soiled instrument and the entire tray back to decontamination. B. Remove only the soiled instrument and replace it with a clean one. C. Wipe the soiled instrument in the assembly area and continue. D. Continue assembly if the soil is not on a critical surface. Answer: A. Send the soiled instrument and the entire tray back to decontamination. A technician reassembles a multi-part instrument to test its function, confirms it works properly, and then prepares it for sterilization. What is the correct next step before placing it in the tray? A. Lock the instrument in the closed position. B. Disassemble it again as required for sterilization. C. Wrap the instrument separately from its parts. D. Lubricate the instrument and leave it assembled. Answer: B. Disassemble it again as required for sterilization. A tray has gradually had more instruments added over time, and now the instruments fit tightly with little open space. What is the most serious concern? A. The tray will be harder to label correctly. B. The tray may be easier to transport. C. The instruments will stay cleaner during storage. D. Overcrowding may damage instruments and interfere with sterilization and drying. Answer: D. Overcrowding may damage instruments and interfere with sterilization and drying. A technician uses latex tubing to protect the tips of delicate instruments before sterilization. Why is this practice incorrect? A. Latex tubing is too expensive for routine use. B. Latex tubing may prevent the sterilant from contacting the instrument directly. C. Latex tubing makes the tray heavier than recommended. D. Latex tubing causes instruments to become magnetized. Answer. B. Latex tubing may prevent the sterilant from contacting the instrument directly. A technician prepares scissors and hemostats for sterilization and places them in the tray with ratchets close to keep them secure. What is the main problem with this setup? A. The sterilant may not reach all instrument surfaces. B. Closed instruments can damage the tray liner. C. Closed instruments are harder to count. D. The instruments may become dull faster. Answer. A. The sterilant may not reach all instrument surfaces. A CRCST technician wants to include a single-use item in an in-house sterilized procedure tray, but the manufacturer's re-sterilization instructions cannot be obtained. What is the correct action? A. Include the item if it appears unused. B. Include the item only in low-temperature sterilization cycles. C. Exclude the item from the tray. D. Place the item in a separate pouch inside the tray. Answer. C. Exclude the item from the tray. Multiple metal basins are assembled together for steam sterilization, but they are nested too closely and contain no proper wicking material. What is the most likely result? A. Faster sterilization due to retained heat. B. Improved drying because of direct metal contact. C. Condensation buildup that may create a wet pack. D. Better drainage because the basins are tightly stacked. Answer. C. Condensation buildup that may create a wet pack. A technician assembles a major instrument tray by counting a total of 100 instruments rather than verifying each listed item against the count sheet. What is the most serious problem with this method? A. It takes more time than standard assembly. B. It may allow missing or incorrect instrument types to go unnoticed. C. It increases the need for internal chemical indicators. D. It prevents the tray from being labeled correctly. Answer. B. It may allow missing or incorrect instrument types to go unnoticed. A tray is missing one required clamp, and the technician substitutes a similar-looking clamp without approval, so the tray can be sterilized on time. What is the correct evaluation of this action? A. Incorrect because substitutions require user department approval. B. Acceptable if the user is notified after sterilization. C. Acceptable if the substitute instrument is the same size. D. Incorrect only if the tray is for an emergency case. Answer. A. Incorrect because substitutions require user department approval. While assembling a tray, a technician places delicate microsurgical instruments underneath several heavier retractors to make everything fit. What is the most likely consequence? A. Increased risk of damage to the delicate instruments. B. Better sterilant penetration to delicate instruments. C. Improved tray stability during transport. D. Easier instrument retrieval during surgery. Answer. A. Increased risk of damage to the delicate instruments. A technician places gauze sponges inside an instrument tray to act as extra cushioning and wicking material. Why is this practice wrong? A. Gauze is too costly to use for packaging support. B. Gauze may interfere with our sponge counts and create confusion. C. Gauze cannot absorb enough condensate during steam sterilization. D. Gauze makes the tray too light for proper sterilization. Answer. B. Gauze may interfere with our sponge counts and create confusion. A powered surgical instrument is placed into its tray with the trigger handle active and the power switch still on. What is the best correction? A. Wrap the instruments separately inside the same tray. B. Turn the power off and place the trigger handle in the safety position. C. Add more padding to prevent accidental activation. D. Remove the internal chemical indicator from that tray. Answer. B. Turn the power off and place the trigger handle in the safety position. A user opens a sterilized tray at the point of use and finds no internal chemical indicator inside. The tray's external packaging looks intact. What should happen next? A. Use the tray if the external indicator changed properly. B. Use the tray if it was processed in a normal load. C. Use the tray only for non-critical procedures. D. Do not use the tray because packs without an internal CI should not be used. Answer. D. Do not use the tray because packs without an internal CI should not be used. A technician selects packaging for hydrogen peroxide sterilization that contains cellulose fibers. What is the most likely result? A. Improved absorption of residual sterilant. B. Better drying after the cycle. C. Cycle interruption or incompatibility with the sterilization process. D. Stronger tamper evidence after processing. Answer. C. Cycle interruption or incompatibility with the sterilization process. ACS technician selects a woven canvas wrap for a steam sterilization pack because it is strong and reusable. What is the most important reason this choice is incorrect? A. Canvas is too heavy for routine package handling. B. Canvas may impede steam penetration and drying. C. Canvas cannot be inspected on a light table. D. Canvas creates excessive tamper evidence. Answer. B. Canvas may impede steam penetration and drying. During inspection of reusable textile wrap, a technician finds a stain that remains after laundering. What is the correct action? A. Use the wrap if there are no holes or punctures. B. Cover the stained area with a heat-sealed patch. C. Remove the wrap from service if the stain cannot be removed. D. Use the wrap only for lightweight packs. Answer. C. Remove the wrap from service if the stain cannot be removed. A technician assembles a muslin-wrapped set and compresses the contents tightly so the package looks neat and compact. What is the main risk of this practice? A. The package will be too light for processing. B. Fibrous swelling may be restricted, preventing proper sterilant penetration. C. The wrap will become easier to open aseptically. D. The package will require fewer layers of wrapping. Answer. B. Fibrous swelling may be restricted, preventing proper sterilant penetration. A rigid sterilization container is loaded and carried by its lid instead of both side handles. What is the most likely consequence? A. Improved control during transport. B. Reduced total container weight. C. Damage to the seal or instruments inside. D. Better drying after sterilization. Answer. C. Damage to the seal or instruments inside. A technician is preparing a rigid container with a disposable filter. The filter has a small fold along one edge but still covers the opening. What should be done? A. Use it, because the fold will flatten during sterilization. B. Use it only for steam cycles. C. Replace it, because filters must fit without folding or crimping. D. Add a second filter on top for extra protection. Answer. C. Replace it, because filters must fit without folding or crimping. A paper plastic peel pouch is chosen for a hydrogen peroxide sterilization cycle because the contents need to be visible. Why is this selection wrong? A. Paper containing packaging is not compatible with hydrogen peroxide sterilization. B. The plastic side blocks visibility after sterilization. C. Paper plastic pouches are only for ozone cycles. D. Hydrogen peroxide cycles require rigid containers only. Answer. A. Paper containing packaging is not compatible with hydrogen peroxide sterilization. A technician places a hinged instrument into a peel pouch that is slightly too small, with the tips facing the paper side and almost touching the seal. What is the most serious concern? A. The item will dry faster than expected. B. The pouch may rupture and the paper side may be punctured. C. The label may be hard to read after processing. D. The instrument will be easier to present aseptically. Answer B. The pouch may rupture and the paper side may be punctured.